Good morning, it's Dr. John McCormick. Welcome to the Pulse of Healthcare Halloween edition. And this morning I'm sitting here with the scariest person I know, my father, Don McCormick, and totally unplanned podcast today. I've had a lot of things kind of marinating on my mind. A lot of people ask me how I got in the healthcare business, and I said I didn't have any choice. I was kind of born into it. Uh, my father's been in the healthcare space since the 70s, opened one of the first HMOs in the state of Texas. And so when we say there's nothing new under the sun, we really mean there's nothing new under the sun. But what we see is kind of the evolution of healthcare from small, tight, locally controlled groups where people were getting great healthcare to massive networks that are fake, and that deliver very poor health care. And then a lot of our independent physicians being gobbled up by Wall Street, and the motives has shifted from delivering care, to, I hate to say it, corporate greed. We're really chasing dollars instead of chasing wellness. And, as you can imagine, I've had thousands of discussions like this over the course of my life. And I kind of wanted to zero in today and get my father, Don McCormick's kind of thoughts on where he started in the business, some thoughts about how that evolved, and how we can get back to that community based care where we're actually giving people what they need when they need it at something that's not making them go bankrupt. So, with all that said, Don, that's a kind of a big tee up, but there you go.
Oh, thank you, John. I appreciate that. And I liked all the help you gave me when you were 8 years old and sitting on the floor sorting papers and trying to figure out which person belonged to which policy. That was good.
I'm not gonna mention the failure rate on that one.
Well, I probably wouldn't be in this business at all if I hadn't decided when I was a very young man to follow my inspiration in the church. And I thought that being a believer, that I could do some good in life. But the first thing I had to do is get some knowledge. I had to find out what was going on. And so I was helped in getting into the University of St. Thomas. And there I studied history, and then I studied English and philosophy and theology to discover that my vocation was probably to get married and have 7 children. So that
Second oldest, by the way, second oldest.
And then when I got out with several of those children already, by the time I graduated from college, because I went in the Army before I went to college. So I was sort of an older graduate from the university. I had to look around and say, well, I really ought to have a job, right? That would be important, and with all these children, it would be really important to work. So I went to the Texas Employment Commission, and I gave them my copy of my diploma, and I said, here I am. What do you want me to do? And the guy says, are you going to teach school? And I said, no, I wasn't thinking of that. And he says, well, son, he says, why didn't you study something for which there is a job? And I said, well, I thought that, I would probably become a priest or something, and then the church would feed me and clothe me and make me feel important and a leader. And he said, well, unfortunately, that's not where you're going, because you didn't go far enough in school, or you weren't smart enough to be one of those guys. So I said, well, okay, so what's up? And he said, well, I tell you, Allstate Insurance requires a college degree in order for you to get a job. And you have a college degree, but they don't require anything else, and you don't have to know that much, and they train you. So I'm going to send you over there. So I said, well, okay. I said, well, my mother is a manager in a claims office for an insurance company, so maybe that's not a bad job. So I took the job, and the training was wonderful. It was one solid week of studying the stolen exams that Allstate had gotten from the state so that I could pass the license examinations. Now, and
We
of course
disavow that. No, no. I was doing that on behalf of Allstate.
I explained, they explained the insurance principle to me. The insurance company promises to pay you very large sums of money sometime in the future if something bad happens to you for a very small amount of money now. And I said, well, that's pretty simple, he says. And we use 60% of it to pay for the claims, and we use 40% to pay ourselves and our overhead. And that's what the actuaries told us we needed to do to be on the safe side and to become richer and richer and richer every year, as all the insurance companies have done. Not all of them, but all of the big ones in the United States. So I said, well, that's simple. All I got to tell people is just bet $2, and if you win, you'll get $10,000. So
it's a lottery system.
It's a lottery system. Now, I didn't realize, though, that there was actual calculations and numbers and contracts and words all standing behind all that stuff. So after about a year with Allstate, which was a decent job, they put me in a Sears store, and people passed by me and said, the government asked me and requires me to have auto insurance. Can you give me some? And I said, yeah, just sign right here. So I said, well, this is easy. And then the insurance company came to me and said, Don, we don't make much money on that. So why don't you sell them life insurance where we can really make some money? Because nobody ever claims that until after they're dead. And all the claims we pay out of it come from the money we hold from them and the interest that they earn on it, and that pays all the claims. And that's been true since the 1900s, and it's true today. So please sell that. And I said, well, that doesn't sound like such a good idea. And it's hard because you have to talk to people, and then you have to start lying to them right out of the box. You can't fake it and say, the state's making me do this. That's the reason you're paying this price. So now this sounds like a terribly kind of conservative backlash agenda, doesn't it? But it isn't, because in my mind, I don't have any thoughts like that. In fact, I've never had any thoughts like that I could think of. If I could think. That's the other problem. And I'm very old. I'm 83 years old, so my ability to think is slow. And I don't like to ask questions.
You wouldn't know that if you met him directly.
Anyway, all that happened is that during that year at Allstate, I started playing golf with an old man who was about 65 at the time, who was an actuary. I didn't know what actuaries were. In fact, I had to look the word up because I never met one personally. But he was somebody that read contracts and did numbers and figured out what the cost of everything was. So I said, well, that's interesting. So he agreed to tutor me and let me work for him in his office. And so we began analyzing all kinds of insurance policies for customers. And his customers were lawyers and CPAs. And I don't know why I picked on them, except that they were people that are typically contract readers and understanders and do math and things like that. So that was easy for him to do that. So we did pretty well, and I really kind of liked the work. And it was before computers. I mean, I know that's amazing. I know that computers actually go a long way back, but at the time, you had to have a lot of money to own one and a great big machine to use to get it to work. And then you had to read these big wide sheets of paper with all these numbers on it in order to use them.
And use punch cards.
So we used punch cards, but they did still have the Marchand calculator, which was it had no paper feed for it, so you had to write down the results, and it had little windows with the numbers in it, and it had a whole array of numbers on a keyboard, and I could use my left hand to put the numbers in from the information on the policies, and my right hand to write the answers down. So I found out that I could do analysis of someone's life insurance policy with only 5,000 such calculations. And it only took me 1 week to finish the work on a collection of policies that clients had so that the actuary could tell them, this is what you should have done, and this is what you can do. So that's what we did. The consequence of that is I wound up on a radio show. Oddly enough, the J. Kent Hackelman radio show, which was on FM, AM radio at the time. It was very popular in Houston. And I had discovered in reading all these policies, and particularly the auto policies, that one of the things about it was that the actuaries that did the rate setting for automobile insurance in Texas had made a mistake in the rate manuals because they lacked the experience of people that had deductibles on liability insurance. And that seems pretty far-fetched. But the mistake was significant enough that it caused somebody who took a $100 deductible on a collision insurance could reduce the cost of that collision insurance by about 30%. So if you did it on collision and comprehensive and on liability, then you would wind up saving about 20% on auto insurance at a time when auto insurance rates were fixed by the state of Texas. Everybody paid the same. And then the only way you got any money back was a dividend that the insurance companies gave you at the end of the year, which is their sharing of their profits in the program. So I told that story to the labor unions that were on the radio program with me, and one of them was the Oil, Chemical, and Atomic Workers Union, and the other was the steel workers, and then the AFL-CIO. And they told me, well, we will get our union members a group insurance policy just like you described and save them money. Can you do that? And I said, of course I can do that. And I had no earthly idea whether I could do anything or not. But I left that meeting saying, well, these unions, these are big. I can do something. Maybe I can do something with this. So I started calling around, and I found Metro Insurance Agency in Dallas, Texas. And they represented Kemper Insurance Group. And so I told them, I've got the labor unions wanting to do a group policy. Can you do something like this? And Kemper said, yes. And that sort of launched a 27-year-old man into a long, long career, because the consequence of that contract resulted in us writing about 10,000 auto insurance policies over a period of about 5 years, which is where John comes into the picture, because he had to assemble a lot of it in the floor in the living room. And he got... So that was our introduction, but in that process...
So in the 60s, if you didn't get the right ID card, it was probably my fault. I'm just saying. We still suffer from that today sometimes.
Yeah.
But if you didn't get the right ID card, my fault probably. Yeah. But I was 10 years old, so.
But this oddly enough, that labor union relationship catapulted me into the health business unexpectedly, because the labor union was represented by a law firm for their business called Wood, Luxinger, and Epstein in Houston, who also represented the St. Joseph's Hospital and the physicians that were around town that worked at that hospital. And one of the physicians that they were introduced to was a guy by the name of Larry Heidemann, and he was an internist, and he was a researcher in the School of Public Health and specialized in writing grants, is what it amounted to, because he didn't like to practice medicine. So he got a grant to form an HMO. And I didn't know what HMO stood for.
And most of the audience doesn't either. That's a health maintenance organization, but really what that is a narrow network of physicians that would allegedly, help control the healthcare spend, right? I mean, by controlling who they're going to, where they're going, hospitals are seeing, specialists are seeing,
Right.
Ultimately the goal would be to, deliver a higher quality of care within a narrow scope of physicians, and reduce cost.
Yes, that's the idea. And that's what I listened to from Dr. Heidemann for about 2 hours in the lawyer's offices. And I just nodded and acknowledged it, not actually understanding any of what John just said. But my nodding and smiling while he was talking caused him at the end of his presentation to say, well, you're really smart, aren't you? And you also, can help me by getting me another grant, by doing the research on whether somebody will buy something that costs more and delivers less. So I was interpreting that. I was listening to him. And I went to the labor unions afterward, and I asked them, I said, would you buy an HMO if you had to go to a narrow network of physicians and receive services that were of higher quality but cost slightly more at that time? Because insurance was cheaper at that time. Health insurance was cheaper than the HMO. And the union said, are you crazy, Don? Did you come to tell us something like that? You just go away. Don't bother us anymore. And so I wrote that down. The unions don't want this. And they said, they're very blunt. They said, no, we just want health care. And if the employer doesn't give us health care, then we just don't work. That's the way we handle that particular problem. They pay for it. They worry about whether it's good or bad, and then we get the benefits. And that's still going on, pretty generally. So it's very difficult for the union to see that they need to do something that's more economical. And I say that because the HMOs became more economical over time because it was a narrow network of people who were paying attention to what was going on all the time and were saying no when people tried to do things outside of their narrow network. The Kaiser model is what it amounted to. So
that's interesting because, we have a lot of discussions about networks all the time. Matter of fact, I did a podcast about kind of the origin of networks and where that came about. And really the fallacy of these large Department of Insurance driven PPO broad networks that people are bought into because they're buying a brand. I'm buying this brand of network, and we have conditioned people since the 60s.
Right.
And it's your fault. I blame you now directly.
All the doctors blame me.
Yeah, exactly.
They say, Don, you ruined our lives.
You did.
You started the HMO
You started
program.
HMOs and PPOs and these networks and convinced the insurance carriers to do this. And so now we've conditioned literally generations of people that they get in a panic if they don't have a quote-unquote network, but they missed the evolution from where you started, where you were really working with a bunch of independent physicians that were working with independent hospitals that were coming together to help deliver health care. And what we have now is a bunch of Wall Street-owned doctors owned by Wall Street-owned hospitals that own the Wall Street-owned pharmacy that are in the business of, taking your premium. And if they deliver health care by accident, then that's okay, but it's not productive and it's not something we're trying to get done right away.
Right. Yeah, that's a good summary.
So that I kind of did that to cycle us back to what are we trying to do today? So, when we come full circle all the way around and we went through the evolution of, commercial insurance and blah, blah, blah. And then in the 2000s, we circled all the way back around to, the best way to solve this, at least at a care level, not a coverage level, a care level, is through the association, right? And to really zero in on those types of needs that people have on a routine basis, not the hospitalization necessarily and everything else, but really your primary care, a narrow network of specialists, and then the ability to have that relationship with, hospitals that can deliver care at very transparent prices, which is, part of the struggle we go through today.
Right.
So let's just kind of leap forward now 40 years, or more. aging ourselves.
56 years.
Stop you. 56 years, and jump into where we are today. All right, go ahead. So kind of
The realization of our present condition and what we need to do today, based on what we've seen, is that little thing that the union put in my ear as soon as I went in to ask them, would you take this health care where you're going to a limited group of doctors? And they said, no, that's the employer's problem, not my problem. And they should take care of the economics of it, and we'll take care of using it, all right, effectively. So what I realized is that evolution of that attitude, which is general. It was not just unions, it was everybody, Insurance has a wonderful place in our society because it allows us to put in a few bucks, like the Allstate people said, and get big returns when there's a catastrophe. That's when it's useful. You can't use it to buy groceries. You can't use it to do things that you expect to spend money on every day that you would, to keep yourself alive. You can use it to take care of unusual events. So when you do it, when you use it to take care of everything, all the way down to buying groceries and driving a car and taking care of your house and all those kind of things, it costs more. And the reason is I can't send somebody to the grocery store to buy groceries for me without paying him for his gas and his labor, which adds to the cost of my groceries.
Right.
All right. In fact, that's what really is happening is the health insurance became something that we expect everybody to pay expenses that we would normally pay for out of our pocket directly in our family budget. So we took it out of our family budget. So nobody has money in their budget to pay for health care as an ordinary expense. They think they pay for insurance. The consequence of that, the insurance is driven up in price by approximately 40% because that's the load that insurance companies have in their programs to charge people above the claims that they pay regardless of what kind they are.
Yeah, whether
Okay,
it's
so
an
that's
auto
how
claim or a
simple it
life
is.
claim or a health claim,
It doesn't matter what it is. So if you suddenly start including every ordinary contact and your wellness care and your everything that you're doing to maintain your comfort, all right, in your insurance premium goes up 40%. All right. So the wisest thing that could have been done by the government was to provide everybody with some sort of catastrophic reinsurance care, all right, which cost, oddly enough, a very small amount of money. A reinsurance in an unlimited amount, excess of about $50,000 a year in expense, costs less than $60 a month per person. All right, well, the insurance right now, when you add all of the things under $50,000 that you pay for, cost about $800 to $900 a person in the United States. Now, that's an average. So younger people, it's less, and older people, it's more. But that's the cost, and that's the total cost, out of pocket, insurance reimbursement, and and whatever
claims
loads
payments,
are
whatever,
like,
right?
Whatever's included in it. So what I decided is that it's time that the patients, and all of us, oddly, everybody, even the doctors, are all patients because we all have a limited lifetime, and it's all a decline until you finally get my age, and then you look forward to seeing that light at the end of the tunnel.
That's the train. I keep telling you,
I know,
keep driving.
I know,
keep
but,
driving.
But I think
don't stop on the tracks.
I think it's a promise. I think it's the promise is coming.
There you
it
go.
Is. Okay.
There you go.
Anyway,
okay.
where I become just an atom moving at the speed of light, and but cognizant, not ignorant of what I'm doing. Okay, so what happened is I said, well, what if we just came together as people in little bitty communities in local areas so that we all knew each other, and we said, look, our ordinary expenses, a lot of it doesn't have to be monetized because I can learn enough to help you, change your diaper and your sheets and stuff like that, and you can do the same thing. And I can do a little bit of healthcare. That's something of that, and I can do all kinds of little things that make our exchange with each other, like the Share the Care program that was launched in New York 20 years ago, where a group of women got together and took care of one of their own who had gotten cancer. And by having about 15 or 20 people working together who were friends and family, that woman lived another 4 years, but all of her family and all of her affairs were taken care of, and her personal experiences were good, and all those people learned to love each other and to take care of each other.
And they didn't go bankrupt in the process.
They didn't spend any money doing it because they were only taking 4 hours a week out of each one of them's lives to help their friend. Well, we can all do that, oddly enough. So I said, let's organize so that we have, groups of people who have at least basic skills or share what skills they have in such a way as to take care of somebody that needs it and somebody All right. So I said, let's organize that way. And then when we all get together like that, if there's 300 families, 300 little households that are together talking to each other and helping each other like that, they can hire a physician to take care of them and pay that physician more than that physician makes in scrambling for Wall Street. They'd be paid more than they make scrambling for Wall Street by about 25 or 30%.
So we're really just going back to the 1800s, where you had your family doctor that
Right.
lived in the small community, and the community revolved around the church,
Right.
and people supported one another. And then when you needed medical care, the doctor was supported effectively by the community as an extension of the community.
Right.
And then we've just complicated it by adding 750,000 specialists, one for every molecule on your body, and hospitals that have built large palaces that they think we should fund so we can go in and enjoy them playing piano on our way to the emergency room.
Now wait, I really enjoy the foyer and entrance to Methodist here. It's an art gallery and it's beautiful.
Well,
and it makes me feel a lot better when I go in there and visit my dying relatives.
Yeah, well, they did spend $1 billion. They spent $1 billion on it, and I'm sure they'll collect that back in charges.
Nice.
So that makes it well worthwhile.
Yeah. Anyway, that's a gross exaggeration. There are really only about 35 specialists that we use.
You're
not
right.
750. That's really blowing it away. But I find that those specialists are very eager to do the right thing over the years. The ones I've talked to, they understand and see it and know what the truth is and what they're doing and report it. And some of the most famous among those specialists at some of the great schools like Johns Hopkins have written down that perhaps the way we're doing things is causing a lot of deaths as a consequence of medical care, or they call it death by medicine. And that number is appalling because the chief doctor at Johns Hopkins wrote a book about it, and he was after several other books have been written about it in the last 25 or 30 years. There's approximately 500,000 people a year that die unnecessarily because of the health care they're either getting or not getting in the hospitals and in the clinics. So that number exceeds all of the deaths that we've had in all of the wars since the beginning of this country. That number is only about 1.2 million soldiers killed since the beginning of this country. Yep. But that means that just in the last 2 generations, we've lost more than 15 million people to medicine. And a lot of the doctors are very upset about that and don't get much publicity about it. And it's not an interesting subject to broadcast about. But if the government paid attention to the death rate from medicine, and it exceeded all the pandemics and all the wars, then it looks like they would want to do something about it, but not through the mechanism of buying their groceries and including all of the expenses in it, but by actually doing something about education, organization, community, local control of that community, and freedom to develop it the way people can reflect their talents and their skills and their love.
I love it. Well, we're going to wrap up this episode of the Pulse of Healthcare. That was broad ranging, to say the least, and insightful. Look forward to coming back and talking about some more specific subjects and other things down the road. Thank you very much.